We received a lot of pre-submitted questions, so listen carefully because your question just might get answered today. And we, of course, are joined by Dr. David Spiegel, a medical doctor and the Associate Chair of Psychiatry at Stanford School of Medicine. And we are also joined by Aagya Mathur, who is the co-founder and CEO of Aavia, which is a cycle tracking app. And I will pass it over to you, Aagya.
Amazing. Thanks so much for having me. I'm really excited to be here. There's so many fun things for us to talk about. Really excited about all of the questions that came in ahead of time as well. We're going to try to cover as many as possible here, so just bear with us. I'm Aagya Mathur, as Shelby mentioned. I'm co-founder and CEO of Aavia. My co-founder and I started Aavia because no one told us the whole truth about our health. We had to go out and figure out ourselves why we were facing the challenges we were facing. It brought everything from unexplained lack of energy to even temporary loss of vision every month or two.
Mm.
So, really, most people think of their ovarian hormones as impacting their period and fertility, when in reality, impact so much more of that and throughout the entire month. Quality of sleep, quality of muscle toning, energy levels, sex drive, skin, mental health, mood, risk of injury, appetite, the list goes on. So my co-founder and I started Aavia. It's a daily hormone health app, and it's built to really help you track, learn, and plan around your unique cycle. And we started it out of MIT and are backed by Mayo Clinic and powered by over 56 million data points. We deliver personalized insights based on your personal health logs, science-backed recommendations for workouts, nutrition, productivity, social, to help reduce both mental and physical cycle symptoms. That's why we're really thrilled to partner with Reverie here to really bring forward evidence-based and natural relief to you through their app. And I'm here, as you guys know, with Dr. Spiegel today, and we're excited to learn much more about the science-backed methodology, as well as based off of a lot of the questions, we'll give some background on the whys of some of these pain points as well. So before we go into even more on all the different pain points, I would love, Dr. Spiegel, if you can just kick it off by sharing a little bit of the methodology itself. I feel like a lot of people associate hypnosis not necessarily always with the science side of things. So if you could really just break down quickly in terms of how it really works and how it works in the brain, I think that'll be a really great place to kick it off.
I'd be happy to do that. Thank you. And I'm so glad to see you mobilizing women to use knowledge and non-pharmacological ways of managing their health. It's terrific. Hypnosis is actually the oldest Western conception of a psychotherapy. It's been around for 250 years. And what it is a state of highly focused attention. Have you ever had the experience of getting so caught up in a good movie that you forget you're watching the movie and enter the imagined world? Does that happen to you?
Yeah.
It's been called believed in imagination. So three things happen when you go into a hypnotic state, and it's a naturally occurring state. 2 out of 3 adults are at least somewhat, and some are very hypnotizable. And so you're doing it whether you realize it or not. So why not identify it, mobilize it, and use it to help with your health? So the focusing part is like looking through a telephoto lens in a camera. What you see with great detail, but you're less aware of the periphery. The second part, in order to do that, you have to dissociate, put outside of conscious awareness things that would ordinarily be in consciousness. So you just narrow the lens and put away things that otherwise you might notice. So when people wonder, could hypnosis actually affect pain, for example, or hot flashes? Try this little experiment. Yeah. You're sitting on the chair right now, right?
I am.
Hopefully you are not aware at all of the sensations in parts of your body touching the chair. Am I right about that?
Correct.
If I'm wrong, we could stop the interview now. So our brain naturally does it. It's a huge information processing center. And if we were aware of all the things the brain is processing at any one time, we would just grind to a halt. Couldn't do it. So the brain helps us decide what should we pay attention to and what should we ignore. And that can include pain. And say, the strain and pain lies mainly in the brain. And hypnosis, we have shown actually reduces response to shocks. When we did an experiment with Stanford students, I gave them some mild electric shocks. We recorded the brain's electrical activity in response to the shocks. and it was decreased by 50% within a tenth of a second. So they're
Wow.
actually in hypnosis treating the pain as though it weren't there. And the brain can do that. We do it all the time. Pain is important to recognize. If you've been injured, you need help, but it's not important all the time. And sometimes once you've got the message, your brain can just turn it down or turn it off. And it is so much better and safer. We built Reverie because 118,000 Americans died of opioid overdoses last year alone. Opioids are addicting people who should not be using them. It helps in the short time. For a couple of days, it's not a bad thing to do. After that, it becomes a problem. So
Yeah, absolutely.
hypnotic dissociation is powerful. The third part is actually the most interesting part, but the part that scares people the most. And that is that what happens in the brain is that you inhibit activity in a part called the default mode network. It's in the back of the brain, the posterior cingulate cortex. It's the part of your brain. You have times when you're not working, you're not doing anything else. You start reflecting on who you are and what you become and what you should become and what your mother wanted you to become and all that. So I call it the my fault mode network. It's where you're ruminating about who you are. In hypnosis, you inhibit that activity. And so what you're doing is allowing yourself to try out being different. Now, that's the part, the stage show hypnotists, I don't like it. I don't like making fun of people in public. But when they get the football coach to dance like a ballerina, what it's demonstrating in a bad way is actually a good thing, that he can suspend who he thinks he ought to be and try out being someone else and see what it
Which is
feels like.
incredible. Yeah, for sure.
Yes.
I love that. And so, I suspending what you should be feeling, should be thinking, things like that. Can you help everybody here understand how this differs from mindfulness or
Yes.
meditation and why choose one over the other?
Sure. So they are related, and both Eastern and Western cultures have a tradition of altering consciousness. But the other thing that goes on in the brain in hypnosis that does not happen so much in mindfulness is you turn down activity in another part of the brain, the dorsal part of the anterior cingulate cortex. The cingulate cortex is like a C on its ends in the middle of your brain. The front part is your alarm system. It's what goes off. You hear a loud noise and say, oh my God, what's happening? It hijacks your attention. In hypnosis, you turn down activity in that area. And in mindfulness, you don't necessarily do that. You have open presence. You're aware of things. You just let them flow through you. You don't fight them. You do a body scan. You cultivate compassion. Those are all good things. But hypnosis is more about solving a problem. In meditation, you're supposed to change your presence, change the way you deal with difficult things. That's a good thing to do. But it's more about just being, not being different.
Yeah.
In hypnosis, it's more about doing something. You do it for a purpose to solve a problem. I had a patient who was a 10-year meditator, twice a day for 10 years. She said, Doc, I
Wow.
still have migraine headaches.
Yeah.
Can you help me? So I got her hypnotized and had her imagine a bag of ice on her scalp because migraineurs often feel heat
Right.
in their head. She called me back a week later. She said, my migraines are gone. Thank you for freeing me to use my intentionality.
Well, okay. We
So
love
yeah,
that.
yeah. So, in meditation, you're not supposed to be intentional. You're supposed to just be. In hypnosis,
Yes.
you do it for a purpose, like
And that's,
reducing pain, getting to sleep,
yeah,
staying
for
asleep.
sure. And I love that. And so we'll hopefully go through a little bit of each of those. So one of the great things that I heard is when somebody was in a state of hypnosis, they were getting shocked. They weren't necessarily feeling it to the extent that they would if they were not. And
Correct.
if you think of something like menstrual cramps,
Mhm.
millions of people with ovaries around the world experience them on a regular basis. That's something that, of course, could live without, right? So it seems like there is this connection of where we can actually reduce some of the pain, the experience that we're having there. So can you take us through a bit of, let's say that they're getting cramps 3 days in a month. Should they be doing hypnosis before it starts? Should they be doing it during the cramps? Should they do it after? What should a regimen look like in order to really help them through that?
What I do with patients and what we offer on Reverie as well is, first of all, just test and see how hypnotizable you are. People vary in their ability to use hypnosis. And the more hypnotizable you are, the quicker it can happen. But there are other techniques for bringing along people who even aren't that hypnotizable, and you
Right.
learn what your
Sure.
hypnotic style is. So for some people, you can imagine you're floating in a cool mountain lake, cool tingling numbness, filter the hurt out of the pain. And you know what? It's gone. I had 2 people feel that way in my office yesterday. So within minutes, they can just change the way their level of pain feels and learn to filter the hurt out of the pain. For some people, they focus on leaving their body here and going somewhere else. So, your body's uncomfortable here. Why don't you go somewhere you make yourself feel better? So go to a Hawaiian island or a mountain lake or something. So you
Would
can
love to.
learn. Yeah. Okay. Well, anytime. So you teach people to practice this and see how their bodies feel. So you then learn what the skill is and practice it. It's good at first to do it every once or twice a day to get the feeling of it. And then if you start to feel the cramps or if you start to feel the hot flash, go into the state of self-hypnosis and take charge of what that experience is like. So you can imagine that you're floating, for example, if it's a hot flash in a cool mountain lake, cool tingling numbness, filter the hurt out of the pain. Or if it's cramps, you can imagine you're somewhere where you get relief. Do you take a warm bath? Well, if you do, your brain is getting reset in that warm bath to experience the sensation differently and to emphasize the warmth more and the discomfort less. So your brain can get reset to do the same thing even when you're not in a warm bath. And that's where hypnosis can help. You don't worry about the fact that you're not actually in a warm bath. You just learn to feel what it feels like when you are.
Right.
And
That's
so
so
you can do
wonderful.
it. And you can do it within minutes. It's not a
Right.
big long.
Yeah, I have done that actually. So going through some of the reverie sessions, for me, it's been actually a little bit more on focus, which I know we're not
Mhm.
really talking about right now, but that's what I needed help with. So that's what I
Cool.
wanted to experience. But it is interesting to kind of be somewhere, do something that you didn't know that you could actually get yourself to do, right? And that's something that's wonderful about this is that we have so many of our members who talk about pain, especially menstrual pain, both on the mental and physical. We haven't really covered mental yet, but on the physical side, these symptoms that they're like, I can't take any more ibuprofen. There has to be other remedies.
Right.
And we're proud to be able to recommend reverie to them. And especially with just how evidence and science backed it is, that makes it an example like this as well, right? But
Thank you.
understanding that you have to test the hypnotizability is something that I will take away from this as well. So
Good.
that's great
Okay.
to see and hear that from a discomfort, being able to decrease that as well from the physical side. And shifting a little bit to the mental health side, I know that there are similar to with cramps and people taking a lot of ibuprofen, similar things, right? For anxiety, for depression. And I also was reading through a lot of the research that you have online about how there are just like, this is a drug free way to get to the bottom of anxiety or to help with anxiety, whereas a lot of people are taking a lot of different drugs. There are side effects that come along with that.
You got it.
Are there side effects to hypnosis?
No, the only side effect is that you feel better and it doesn't cost anything. There
Excellent.
are not. And in fact, what some of the brain imaging we've done has demonstrated that in that dorsal anterior cingulate part of the brain, it's a part of the brain that is involved in stress reduction, either, worrying if you need to, but not worrying if you don't. And hypnotizability is associated with the presence of an inhibitory neurotransmitter, GABA, in that part of the brain. That's the same neurotransmitter that is increased by benzodiazepines, by anti-anxiety drugs. So you got your own little pharmacy up here and you don't get addicted to it. You can just use it. So you can
Right.
mobilize this part of the brain to induce anxiety reduction. And anti-anxiety drugs, I use them with my patients sometimes, but not very often. They're habit forming. Some people get
Yes.
depressed. They go from anxiety to depression when they take them. And there's this rebound phenomenon, as there is with opioids for pain, that once you start to reduce it, you feel more anxious, or you feel more pain if you're taking opioids. So you're kind of trapped where you
Right.
used it initially to get relief, and now you're stuck because when you start to withdraw, you have more anxiety or more pain. So
Right.
hypnosis can be combined with it too. So if you want to reduce your dose and get off them, do your self-hypnosis to imagine you're floating somewhere safe and comfortable, a bath, a lake, a hot tub, or floating in space, and dissociate your physical reaction from your mental one. We get trapped in anxiety because there's a snowball effect. You get worried about something, some work you have to do or something. Your body tenses up, your heart rate goes up, you start to sweat, your muscles tighten up. And you notice that and you say, oh my God, this must be really bad. And so you get more anxious and then your body reacts to that. It's like a snowball rolling downhill. And instead, what we do is we start from the body up. The one thing in any stressful situation you actually can control is how your body is reacting to it. So start there. So
Yes.
you get your body floating safe and comfortable, and then think through how to deal with the problem.
Yeah. And just for the audience, I know there were a lot of questions about emotional and mental health. So just a little bit of background here. So our hormones are fluctuating throughout the month. There's actually a lot of people think that they go pretty flat and then they go crazy when you're on your period, but it's actually not like that. There's actually ups and downs throughout the entire month. And with steep changes or with just changes in general, that does cause changes in all of the things that I mentioned earlier, right? Quality of
Right.
sleep, quality of muscle toning, energy levels, sex drive. But mental health and mood is a big part of this as well. And so a lot of people, say like, oh, I feel crazy, or I don't know why I picked a fight with this person, or I don't know why I'm being mean today. A lot of this is actually your hormones. And so this, by using Reverie, can be an opportunity to really reel some of that in if you are feeling a little bit more out of control as well. And one other thing that I would love to note here, since a few people were talking about this, is depression. I know we talked about a little bit earlier. Depression is typically and obviously, Dr. Spiegel, please jump in here. But depression is something that you are experiencing more or less on a daily basis. But when it comes to hormone health and depressive feelings, sometimes they actually are during a specific time of your cycle, the week or so before your period. And if you're having intense depressive feelings during just that time of the month or just that time of your cycle, oftentimes it can actually be something called PMDD, premenstrual dysphoric disorder, which is
Right.
actually caused by your hormone. So
Mhm.
if there's anything you'd like to add to that, I'd love to open that up for you as a doctor. But I know
Sure.
that's something that's just very important for people to understand, as there's not very much education out there about this and not very many people know about this. And I know through Aavia, at least, a lot of people have learned, hey, actually, it's not depression, it's PMDD. This requires a different kind of outlook. So would love to just dive into that a little bit.
Well, it's not just the hormones, it's how the body and the brain react to the hormones. One of the ways in which they do is that
Exactly.
estrogen tends to inhibit cortisol. And when the estrogen levels suddenly drop, cortisol, which is one of the primary stress hormones produced in the adrenal cortex that mobilizes glucose in the blood so you can fight or flee, can go up. So you may have this sudden change in your unconscious awareness of the level of stress hormones in your body. So you may be acting more stressed than the situation demands because you're getting the physiological signal, there's something going wrong, I better do something about it. So recognizing that you will be destabilized by sudden changes in hormones or by drops in estrogen, progesterone in menopause can help you recognize that the feeling of discomfort doesn't necessarily have the same meaning as a genuine elevation in stress hormones if there was a saber-toothed tiger outside the window. So it's one of these things where you can use self-hypnosis to regulate your somatic, your body response, and also your psychological response. With depression, the problem is that people tend to overemphasize negative information and underemphasize. You tell a depressed person 9 good things about them and 1 bad thing, and what do they remember? They remember the bad thing. So these things will also distort your perception of yourself and who you are back in that default mode network. So I would advise people to work on how they can regulate the way their body's feeling and then regulate their emotional balance using self-hypnosis. And there was a question from one of our listeners about what about people who aren't so hypnotizable? The approaches we're taking work even if you're not that hypnotizable. It may take a little more work from you to do it. But in fact, focusing on what you're for, focusing on seeing these difficult situations as an opportunity for mastery rather than an example of defeat can be a way to help you cognitively approach the problem in a more positive and effective way rather than negatively.
Great. And then can you also, for somebody who might think that they have something like PMDD, Or also, there's a number of other conditions that today take 7 to 20 years to diagnose, from PMDD, PCOS, endometriosis. And as a quick plug for Aavia, we actually flag a lot of these conditions within 3 to 6 months. But once you even have that data, let's say you're even using Aavia and want to take it to your doctor, what's the best way to advocate for yourself for that?
Well, I would say, recognize that it's a complex problem that has a lot to do with not just with the stimulation or the potential ovarian dysfunction, but also from the way you have been taught to react to it. And rather than feeling helpless and, oh my God, something's going on in my body and it's driving me nuts, you say, all right, this is a challenge. I understand the challenge, and I'm going to build a set of skills like going to Reverie and learning to manage anxiety, stress, pain, enhance your focus. And so you can see it as an opportunity for growth, an opportunity to build yourself as a better woman as time goes on, and you have to deal with the things you have to deal with. So you want it to be a mastery experience. And that can happen quicker and easier if you're very hypnotizable, but it can happen for anyone if they just take a different point of view about these problems.
Right. And so let's say, you think that you might have this and now you want to go talk to your doctor about it, though, right? To see what they recommend, not just from a hypnosis standpoint, but from exercise, from nutrition, whatever it might be. What are the best ways to advocate for yourself in that medical setting to be like, okay, I do have this diagnosis, or now I can get the care that I need, so that it takes less than the 7 to 20 years that it typically takes to get diagnosed?
Well, I would advise you to experiment with techniques like Reverie and go to your doctor, teach your doctor something about how you are learning to approach these problems from a different point of view and see it not as a weakness, not as something that automatically needs a pharmacological intervention, which it might, but it might not. And enlist your doctor in helping you identify the problems and develop ways of handling them differently. And if you approach the doctor from a position of strength, I've tried this, it seems to work. How can we work together using it? You'll get a lot farther and you'll help your doctor.
So I know that we are short on time here, from like a stress and sleep perspective as well, right? Those are two things that,
Yes.
whether you have ovaries or not, you probably are dealing with some element or another of stress coming up, not being able to sleep as well, whatever it may be. Can you talk a little bit there about how there you have some research on that as well, of like just like the impacts of, instead of taking melatonin and becoming dependent on that again, or instead of other types of treatments, how this can help? So can you talk a little bit about what causes these, in when people can't fall asleep or can't stay asleep, what causes that, from a, whether it's hormones to start or otherwise, and then from there, however we can help?
Well, sleep requires quieting your sympathetic nervous system, the part that stimulates fight or flight, increases your heart rate, elevates your blood pressure. Sometimes you need that, but that's why an alarm clock wakes you up. You suddenly go, oh my God, what is this? And you're up. Increase heart rate, blood pressure, wake up. The contrary is the parasympathetic nervous system. It's the rest and digest, not the fight or flight system. And it's the part that you need to kick into place in order to go to sleep or to stay asleep. And so you can use self-hypnosis and sometimes breathwork techniques to just exhale slowly. We call it cyclic sighing. Inhale quickly and slowly exhale through your mouth. And you trigger the parasympathetic activity that allows you to sleep. So it's a matter of, again, starting with the body first. Get your body comfortable, through that sympathetic arousal, and open up the door to parasympathetic activity. And you can allow yourself to sleep. So again, view it as a challenge that you're learning how to deal with. And just as with other mental health problems, with sleep problems, there are medications that sometimes help. But particularly with chronic use, the medications, instead of solving the problem, can become the problem. And so what you want to do is build up your ability to manage these things by yourself, and hypnosis is a great way to do it.
Great. And do you think hypnosis can actually help with confidence or self-esteem or overcoming imposter syndrome?
Absolutely. Look at me. I mean, I do it all the time. Yeah. Yes, it does. You enhance your ability to focus on what you're for, what you want to do, how you want to come across to an audience, how you want to interact with your boss, and put aside the things that have chronically inhibited you. put aside that struggle in the back of your head. Maybe I'm not up to this. Maybe I shouldn't have done it. I should have done something else. Put that aside, try out being different and see what it feels like. Focus on what you're for. And with the intensity of focus in hypnosis, you can do that better.
Amazing. And what do you think are things that keep people from trying hypnosis? Or like, what are some maybe common myths about it that keep people from trying it?
Well, the stage show thing, is somebody making me quack like a duck or something like that. You take a risk when you change yourself. You try out being different. You leave that comfort zone of I've always done it this way. That's a wonderful opportunity to learn and grow. It makes people anxious. So, people might not approve of me. I might not do it well. So what, but give it a try. And that's what we work in psychotherapy. It's what we work for in psychiatry. It's what we work doing, growing in various ways. In a balanced way that you can actually do, focus on the experiment of trying out being different. That makes people nervous. But the main thing is you're not losing control in hypnosis. You're
Right.
gaining control. You're not letting someone take over. We're social creatures. We're susceptible of social influence, God knows. But we also, in hypnosis, are free to make a choice. Do I do this or not? And so you're learning, someone teaching you hypnosis is teaching you how to enhance your own control of mind and body. And that's a good thing, not a bad thing.
Great. And if somebody, is just getting started, let's say after today, they're like, okay, I'm going to go download this app. I do have both physical and mental symptoms from my cycle. How long do you think that they will need to get started? And maybe it's different for both physical and mental, or it's the same in order to see results?
You should look for results in the first 10 minutes. We have found that 4 out of 5 of our users feel less stress, less pain within 10 minutes afterwards. So the cool thing about hypnosis is you will know right away whether what you're doing seems to be helping you or
Okay.
not. So it's worth 10 minutes to give it a try.
And
Go
that,
to Reverie.
yeah. And that's 10 minutes, which is much faster than having to go to a doctor's appointment or to have to go see a therapist. Obviously, should still do those things and hopefully use this in combination. But
Yes.
even if it's leading to some relief in the meantime, is
Yeah.
really beneficial, which is incredible. I know we are at time here. I am really glad that we got to have this conversation today to really talk about hormone health, how hormones impact us beyond just our period of fertility, whether it's the physical or it's the mental or both, and then how we can actually use hypnosis, use this methodology in terms of natural relief for a lot of those things. Dr. Spiegel, are there any closing thoughts you'd like to leave us with?
I just say focus, dissociate, and try out being different, and you'll enjoy it.